Just waiting for Kevin to join.
Hello.
Hi!
Hi.
What a fun background.
Thank you. So sorry for the delay. Just had so much issues connecting with my Wi-Fi, but I managed to get it all sorted out. But happy Friday, Tommy. How are you
You're
today?
so right. Oh my God, it is Friday. This
Right?
week went by so fast.
It blew past by us. So let's get started. Welcome everyone. My name is Kevin from Whitman-Walker. I work with Tommy in the community health department. We're both health educators. So right now during COVID and the pandemic, we started doing Instagram lives and using social media more to talk about different topics and have different conversations about sexual health, harm and risk reduction, safer sex practices, access to HIV and STI testing during COVID. We talk about monkeypox and monkeypox vaccination. And so right now we're doing a series regarding monkeypox and staying safe and healthy. So once again, my name is Kevin Contreras, pronouns he, him, his.
And I'm Tommy, pronouns he, him, his. I'm working with Kevin at Whitman-Walker, community health field. Yeah, we've been doing these little Instagram lives, these little education Instagram lives to keep you guys updated with any new information that, comes about, particularly information that revolves around monkeypox. And this live is going to be in regards to monkeypox after you get your vaccination. What could happen, what can happen, what you need to do, what you need to continue doing to keep yourself safe and everybody else safe around you. Um, Remember that monkeypox is this rare but potentially seriously illness that can be transmitted from person to person through direct contact, with bodily fluids or with monkeypox lesions and rash. Some of the symptoms that people can have once they've contracted HIV, monkeypox, is fevers, headaches, muscle aches, back aches, swollen lymph nodes, chills, exhaustions, and skin lesions. A lot of it is similar to like a common cold. So, if you have any of those symptoms, just make sure you go to your healthcare provider, get yourself checked out, and, keep yourself up to date. Um, and we all know that, vaccinations are always important when it comes to tackling new viruses, in particularly with COVID. The last 2 years was challenging with getting vaccinations, updated vaccinations, where to get it, how to get it. And, the vaccinations have proved to reduce a lot of the side effects when it comes to when you have COVID. It reduces the severity of the symptoms that you can have. It also, because COVID was also killing people. So vaccination is definitely very important. And, we tackled that for the last 2 years. It's still here, but now monkeypox is very relevant today. So there's something else that we got to tackle now. And there's tons of vaccinations that are being distributed now. to get yourself vaccinated, protect yourself and everybody around you. It's very important.
Yeah, thank you, Tommy, for sharing that. It's really interesting because I was thinking about, my experience with, COVID and vaccination and getting vaccinated. I actually did end up getting COVID after being vaccinated, right? And I think, when we think about vaccines, some of us, myself included at the beginning, I thought, surely I'm vaccinated. I'm not going to get sick. I'm not going to catch anything. And yet it happened, right? So, for me, like the way I see it, especially now with monkeypox vaccines and vaccines being more available for monkeypox or MPX, as some of us call it, um, I think of them as a tool for our toolbox to prevent an infection, right? In this case, for COVID-19, if we get the COVID-19 vaccine, or monkeypox, if we get the monkeypox vaccine, or Mpox vaccine. And so we know that vaccines are not miracles, right? They're not 100% uh, effective. Nothing really is. There's always a risk. Um, and even when you do get the vaccine, when you get vaccinated, there does need to be some time, right, to be effective. And even then, you're not going to be at 100% protection, right? Um, So it's still possible, just like we saw with COVID, for breakthrough infections to happen. Similarly for monkeypox or MPX, right? So one must continue to be vigilant, like you mentioned, and just cautious and just practicing, just safety precautions, right? Like, for example, um, if you are working somewhere, like for us, since we work in a clinic, we're constantly, cleaning after each patient that we see, cleaning after, the doorknobs, places that are frequented by others that we touch, still wearing masks if we're going to be in crowded places, and, cold and flu season is just around the corner. So, practicing all of those safety measures, right? Like it's a tool in our toolbox for preventing us from getting sick. But if we use like a combination of different things, such as vaccination, for monkeypox, like if we're being sexually active, to talk to our sexual partners about HIV and STIs, and do our due diligence when it comes to, inspecting ourselves and being aware of our bodies, and um, reaching out to our providers, like you mentioned, right? If we feel that something may be happening, right? Asking questions. We also, just to plug in real quick, we have a monkeypox and COVID line. Um, I believe that should be the 202-207-2480.
Yeah.
Um, so folks can reach out if you have any questions. Um, and so just to talk a little bit more once again about the Mpox vaccine, or MPX vaccine, it's called Jynneos, right? So it does contain like small amounts of a live, non-replicating virus, um, called the vaccinia virus, right? And so it's in the same family as the monkeypox or Mpox virus and a smallpox virus. The vaccine will teach your body, how to fight off the vaccinia virus. But because this virus is very similar to monkeypox, our body will be better able to fight off Mpox after we have been vaccinated, right? Um, but we know that the vaccine provides protection up to 85%, and it can also help reduce the effects of monkeypox or Mpox, if you do get it and when you get it. Um, so yeah, I just wanted to share that real quick, just throwing there
Yeah.
some
Yeah.
little about Jynneos. And
Fun facts.
so
But I think, yeah, people need to understand that the vaccine is not like a cure, so to speak. It's something that's going to help protect you. It's not going to help prevent you from getting it. I mean, you still have cases where you can still get it after vaccination. Look at the COVID. People are still getting up-to-date COVID vaccinations and still, testing positive for COVID. But luckily, because they were vaccinated, their symptoms are a lot less than what they were towards the beginning of COVID. The same goes with, monkeypox. The vaccination is helping people reduce the severity of the symptoms. So that's also amazing and great. But again, it's here to protect you, but it's it's not the cure for it. So some risk reductions that individuals can take is continue washing your hands, continue wearing condoms when you're having sex, wear face masks if you are in public spaces. Let me pin that really quick so people see that. Oh no. Okay. Always talk to your partners about your sexual history, your sexual status, their sexual history, their sexual status. Keep both of yours up to date. Get yourself regularly checked with your local healthcare provider or local wellness clinics. Like us at Whitman-Walker, we are a great organization that can provide those services for you. Um, and if you feel that you've been in close contact with monkeypox, get yourself tested. Find out. That's the only way you're going to know. Continue wearing your masks. COVID is not gone. That has helped. It's also helping with monkeypox. Make sure you are washing your sheets. Because this is you can get it sexually transmitted. Can be in your sheets. Continue washing your hands every day. Like I said before, that's another huge way in order to help prevent the spread.
Yeah, and it's interesting because I think like all the things that we were doing during COVID and the pandemic, we sort of like relaxed a little bit, but those are actually also really good ways and valid ways to also take care of ourselves and stop Mpox, right? Or stop ourselves from getting infected with Mpox, like you mentioned, washing sheets, right? Because we know that contaminated surfaces could potentially mean that someone can get infected that way, right? Or through close contact, like face-to-face contact, right? When we're being physically intimate with someone. Um, so yeah, thank you, Tommy, for sharing that. I also wanted to mention that just a quick update. As far as we know, as of today, DC residents are no longer required to pre-register for the monkeypox vaccination to get an appointment, right? So you are currently eligible, finally, right? Because we know that there were some tech issues with registering and the link and getting an appointment.
Uh,
But you are currently eligible to be vaccinated in DC if you are, once again, a District of Columbia resident, if you're 18 years of age and older, and if you identify as a gay, bisexual, or any other man who's 18 and older and has had sex with men or multiple anonymous sexual partners in the last 2 weeks, or a trans woman or non-binary person who was assigned male at birth, who has sex with men, or a sex worker of any sex, or if you work in a setting or an establishment where there's sexual activity that happens, like a sauna, sex clubs, or bathhouses, you still do need to provide proof of DC residency prior to vaccination. But I also mentioned that vaccination is also available if you work in DC, even if you live in Maryland or Virginia, or if you receive services in DC, such as going to a clinic like ours at Whitman-Walker, you're still eligible to get the vaccine through DC. But you still need to provide proof of residency if you are a DC resident, or just some sort of form of identification if you live outside of DC. Um, so also a utility bill can work. Of course, a state issued ID would be ideal, but if you don't have that, you can use a utility bill or any other mail with your name and address on it, or a current lease or mortgage with your name on it, right? And so as of Friday, August 5th, last month, there are walk-up vaccinations that are available, right? So there's 3 spots that we know of on Martin Luther King Jr. Avenue, on Georgia Avenue, and I Street Northwest. On the monkeypox website, preventmonkeypox.dc.gov, which I'm going to put here in the chat real quick, that you can find all of this information, and you can also see the locations and the addresses for the the Mpox vaccine. And there's also the other websites from the departments of health from Virginia and Maryland that you can watch if you live in Maryland or Virginia, to hear updates from those jurisdictions. So yeah, I guess today we just wanted to talk more about like expectations around vaccine and um, what that means, right? If you're vaccinated, that it doesn't necessarily mean that you're going to be 100% protected, but there's always other things that one can do, like that you shared, that we talked about earlier in this live about staying safe and healthy. And we also have a series, so anyone can check out on our Instagram website or on Tommy's page as
Yeah.
well. We talked about the other day about safe sex during monkeypox, right? And just some ideas. And so we're going to continue talking about this um, for the coming weeks, just so that, you know, we are providing
Keep,
you all with information and resources, right?
yeah. Yeah. I think you forgot to mention too, though. Also, if you go to school in DC, that is also an eligibility to get vaccinated. So if you go to school in the DC area, that's also a way to get yourself vaccinated.
That's very true. Thank you, Tommy, for adding that. Because yes, we do have a lot of people who come here for educational purposes in DC. So that means that you are eligible. Well, any final thoughts, Tommy, about monkeypox vaccination? Um,
I mean, just keep protecting yourselves. Keep yourself updated with all the information that's coming out. We will continue to give updates as we receive them. Um, if you have any questions, you can reach out to my Instagram page, or you can reach out to Whitman-Walker directly if you have questions in regards to monkeypox, getting vaccinated, getting tested for HIV or STI testing. Um, yeah, and just take a look at our other Instagram lives. Those are very informative as well, and they're up to date.
yeah. Well, thank you, Tommy, for having me in this space once again, virtual space, and I will see you around.
Thank you. I hope everybody has a good Friday.
Happy Friday, everyone.
Bye.
TTYL.